Well, welcome everyone to our soap notes class, Crafting Soap Notes, a guide for herbalists. My name is Mel Kasting. I'm the clinical director at Eclectic School, and I'm going to be doing a lot of the discussion here. We have a PowerPoint for you guys to follow along with, including examples. And we have our lovely Tiffany here as an assistant. So if you have any questions, she'll be monitoring the chat throughout the class. There's also going to be time for questions afterwards. Yeah.
And I'm Thomas, and I'm here mostly just to have a fun conversation with Mel about, clinical stuff. This is the first of a series of free classes that we're going to be doing. And yeah, we get to chit chat about our favorite clinical skills and have an audience and take questions and do all types of fun stuff. So, yeah.
Yeah.
Welcome and thanks for coming. Mel, you want to take it away from here?
Absolutely. So I will start by saying I love soap notes. I learned soap notes very, very, very early in my herbal career because my first teacher, Howie Brownstein, got most of his clinical, like sitting with people clinical training from a holistic doctor. And so from the first time that I started seeing clients, I used this very, very strict note taking, and I got used to it. And I realized, as we're going to talk about, how much it helped not just my organization, but my entire clinical practice and kind of the way that I learn how to be with people in general. All right,
I did not start with soap notes. My first 5 years of practice, I didn't do really much record keeping at all. And then I did some record keeping, but it was more like, just reviewing intakes before the rechecks. I didn't have a solid note-taking system. So it was, I'd been practicing close to a decade before I came to soap notes. And I loved them because they fixed a lot of problems that were occurring in my practice. And when I first started, I could remember most of the details of all the cases, but like a decade in and thousands, there's like it overwhelmed my brain, and I stopped being able to remember all the little nuances and details. And I would have to spend like 15 minutes looking over a file before the appointment because I had to go back through the whole process in my brain to arrive at where we left off. So I am very happy to have eventually found a formal note-taking system. And I think that it really helped not only in organizing my practice and how I remembered things, but it helped me organize my thoughts. It helped me become a more logical and rational practitioner because I had to, in my note-taking system, create connected chains that could then be looked at afterwards and kind of do that whole thought process for you. So I think they're great.
I'm going to share my screen. We've got a little PowerPoint for you while we work through.
And yes, this is being recorded, and the recording will be uploaded to the classroom.
All right, can everybody see that? Are we good?
Ooh, pretty.
All right, so what the heck are soap notes? Soap notes are a widely used and customizable documentation method used by a ton of different healthcare providers. We use these to track client information in a structured and organized manner. So they're most common with doctors, nurses, physical therapists, so folks that are working in kind of mainstream medicine, but they're becoming more popular with other practitioners as well, including acupuncturists, massage therapists, and lots of other different types of practitioners. The SOAP stands for subjective, objective, assessment, and plan. So why are they useful? We briefly brought this up in our introductions, but there are so many reasons why they are useful and helpful to any practitioners that work with other people. They're just an amazing way to organize your information. So we sit, depending on how long your intake forms are, our intake forms through the free clinic, the Eclectic School free clinic are, 8, 12 pages. And on top of that, you're going to have all of the notes that you take during your consultation. And SOAP notes are an excellent way to put all of that information together in one place. And this is going to help you not only in the moment, but when you are coming back, as Thomas mentions, for follow-ups. Instead of rifling through a ton of paper or trying to jog your brain and your memory when someone books a follow-up, all you have to do is pull up this document and quickly look through your assessment and your plan and what kind of the work that you had done, and you're prepared. They can also be helpful in terms of liability. So we are herbalists. Thomas and I do not have any licenses above and beyond, just being herbalists. And I think that as long as when you're using SOAP notes, you're careful to not use diagnostic language and to not practice medicine, which, we shouldn't be because we're herbalists, then SOAP notes can be really helpful from a liability standpoint because we're documenting everything that we're doing with our clients. We're documenting our assessment process. And if you do it correctly, you're easily able to, give notes to other folks and in that way, show that you're not practicing medicine or infringing on someone else's license. It's a really great way to communicate with other practitioners. So that's part of the reason we use SOAP notes through the school in our clinical program, because we have a lot of students and it's a quick and effective way to share case notes with other folks. This also really works a lot in the integrative care model. So in my practice, I do a lot of advocacy and kind of a lot of interacting with other practitioners, including doctors and nurse practitioners. And it's really amazing for sending notes back and forth to other practitioners. And honestly, I feel like it makes clinical herbalism look a little more respectful, if that makes sense. Not that that matters so much, but if you're working with doctors, I feel like we have this hump to get over as herbalists because we're not licensed and not a lot of folks know exactly what we do. And so being able to communicate with a doctor or a nurse or another type of practitioner can allow us to speak their language. And they can not only can we understand their notes, but they can see the to them and they can understand our notes. Really very helpful. We can also track progress with our SOAP notes. So we're initially writing a SOAP note after an intake, and then we're continuing to add to our SOAP notes after that initial intake with all of our follow-ups. So it's a lot easier when everything is in one place to track progress, to track client progress. It's a great thing to keep for research. And Thomas might have something to say about this, I don't know. But basically, when you run a school for as long as Thomas has, and we have so many students, we have so many folks that are seeing clients that have all of those SOAP notes compiled because you're seeing, let's say we have 100 cases a year of hypothyroidism or something like that. Maybe that's a little more, I don't know. But basically let's say we have a ton of hypothyroidism cases, we're able to pull up and look at, 80 to 100 different SOAP notes and not only track progress through one client, but see what's working and what's not working over the long term. And, we do it at a larger scale because we have students in addition to our own private practices. But this is really extremely useful just for yourself in private practice as well, and to be able to share with fellow herbalists and other practitioners. And then the piece that I find the most useful is that you can use them to educate yourself. So the act of writing a SOAP note is about your thoughts about a case and working on looking at that data and making an assessment on that data, everything that you've gathered from the intake forms and from your, your initial consultation, and kind of accumulating that together into a cohesive document. So you're learning a lot of different skills that way.
Yeah, I would also say that, when you're writing a SOAP note, you can do somewhat of a self-assessment of like how, as a practitioner, you did in the consult. If you're filling out the subjective part of a SOAP note and you don't have any direct quotes from the client, were you engaged and actively listening in that process? Maybe not as much as you could have been. You can use SOAP notes not just to organize your thoughts, and I think they're great for a lot of things, but one of the things that I value in them is being able to say like, okay, I wasn't as actively engaged in listening to their narrative as I would have liked to have been. I don't have enough details, or I would like more details in this area. They said something and I wrote down a note, but I didn't follow that rabbit trail to where it needed to go. And I didn't realize that until trying to compile it afterwards. Or, you know, I wrote down some thoughts about potential therapeutic interventions when we were in consult. Now that I look at their symptoms and the objective data, I don't, I can't reasonably put together an assessment that would justify this particular intervention. Or maybe I can now put together an assessment that matches the intervention. They're really helpful for my mental organization to ensure that I am not just capturing all of the picture, but that I'm logically linking the narrative with the objective information with an assessment, and only then am I formulating an intervention that is rational. So I think that they're great for self-growth, great for self-assessment, and then, as Mel says, wonderful for sharing with others and research and, saving time on reviewing pages of notes before an appointment. They're super helpful.
Absolutely. That's a great point, that it can help you to see what you've missed. And I feel like we get to see that a lot in the school with the student clinic, as well as absolutely in our own practices. All right. So we talked about, but before I dive into these particular sorts of headings and, the actual nitty gritty of how to write these, I want to say that these are customizable, right? And so these are the headings that we use. All of this might not be particularly accurate to you. So this is something that kind of comes before the S, so the subjective information. This is technically also subjective information. This is just the way that we organize it. And you'll get a complete template of the kind of the way that we organize SOAP notes, but feel free to edit that with more or less information as you need it. So yeah, this is kind of what it looks like, the very top of our SOAP note, and the information that we look for here. So we have our client initials, whoops, and case numbers, a date. Dates are really helpful. Probably if you have in private practice, you don't need to put your name on them. It can be helpful to know how long a consult has been, so we end up putting that. And this top here is just some some kind of basic information that doesn't necessarily fit within the body system. So we usually use the age, pronouns, sometimes the profession, not always, height and weight if it's given, and also BMI. And the PHC, this is primary health concerns. You also see this as chief complaints sometimes. And so for each of the primary health concerns, we like to see the onset. So when did it start? When does the first time the client remembers having this particular health issue? And then we also always like to get a rating of 1 to 10 for each chief complaint or primary health concern. And this we ask on our intake forms, and we like it for a lot of reasons. But one of them is because it's great for tracking progress. So someone might be in a pain that's 9 out of 10. They come back to you for a follow-up, and then they say, oh, I'm still in so much pain. And we say, okay, pain from 1 to 10. And they say 6 or a 7. And we can come back and show the client that they're making progress, which helps with rapport building and trust, and helps them to see that they are making progress, and maybe that also that it can help them to start to make some of the harder changes that we might be wanting to ask them to do. And so we do that for every primary health concern that the client lists on their intake forms, and any primary health concerns that come up during the intake. So that and not every symptom that comes up, but something that they didn't mention at all, like maybe they have severe anxiety, but they didn't mention it in their chief complaints because they're focusing on digestion. But we would still put that into a primary health concern if it's significantly impacting their health and their lives.
A lot of times people come into a consult with a specific goal. And so they might not put on their intake forms a lot of details about other stuff they're experiencing because they're focused on a particular goal. We can add to that and fill it in. And I love starting my SOAP notes with this particular format because at a glance, without having to read an entire SOAP note, I can normally, this is normally enough to jog my memory. Somebody, a client sends me an email, or there's a chat function on my EMR and I get a message and I might not immediately remember all of the details. But typically, like when I see a name and I have a general idea of like who they are and what their main issues were, it's enough to jog my memory. And then I can, fill in more details with the rest of the SOAP notes.
Absolutely. Some general like do's and don'ts type suggestion before we dive into the specifics. So this can kind of go for almost every section. We try to be concise, right? And so it's normal in the beginning of SOAP note writing, whether you've been in practice a long time or not, if it's a new skill to you, to have a difficult time deciding what information should and shouldn't be on the SOAP notes. And so your SOAP notes will probably be longer at the beginning than they are after you've been practicing the skill for a while. But in general, we're trying to be concise. So we're not trying to write an entire, paragraph narrative about every single symptom. And instead, we want to use small snippets or like key phrases that can point to like some symptoms suggestions. We want to avoid our own opinions and assessments everywhere on the SOAP notes except for in the assessment section. So parts of the SOAP notes are more about information gathering from the client or, from observation than they are about assessing. And we really like to use client quotes, as Thomas mentioned, I think earlier on, to get our to get points across. What you don't need to do is use complete sentences anywhere but the assessment section. That doesn't mean you can never write a sentence that deserves a period, but the idea is that we're being short and concise, and it doesn't have to be a full narrative like you're writing the beginning of a paper. And you don't really need to add non-relevant information to our review of symptoms, which we'll go over in a few minutes. So basically, we're wanting to add If someone has hangnails and it isn't relevant to what's going on, sometimes it might be, then we don't need to, maybe we don't need to add that. So our first heading is subjective. So this is the S. And this is a concise summary of the information we get from our client, from the intake forms, our intake, so our initial consultation and follow-ups, including any testing they give us. And the important part is this is free from our opinion or analysis. So we're writing the information as it comes.
Yeah, the people's experience of a health challenge varies greatly. And in the subjective portion, we're wanting to have a concise summary of relevant information from the intake forms and testing, but we're also using this as a place to both record and acknowledge that everyone's experience of health and illness is different. And that's where those direct quotes come in handy, that the individualized experience can become really valuable when putting together an assessment or a plan. Somebody comes in and they say they have generalized anxiety disorder. This is where you put that anxiety is part of the symptom picture, but there's a lot of different manifestations of anxiety, and sometimes the phrasing, the wording that people use clue us into a little bit deeper understanding of what's going on. Somebody that has anxiety that feels like a crushing pressure on their chest is different than somebody that has anxiety that feels like there's a bag full of angry cats in their head. And noting those differences down in this section allows you to acknowledge those differences of experience, and also, in the case of anxiety, clue you in as to potential interventions that have more of a somatic reach versus more of a mental reach.
Mm-hmm. So here are some of the sections that we include in the subjective heading. And if you see, there are medical abbreviations behind most of these, all of these. You will have a list of medical abbreviations. They're of course optional to use. We like to use them. They shorten everything, make it a little more concise. But like I said, you will get a document that has a list of medical abbreviations and what they stand for at the end of class. Okay, so lifestyle history. In this section, we look at diet, sleep, movement, which we choose to use the word movement instead of exercise because of the negative connotation with the word exercise, and because movement is more about enjoyment. Exercise, it's something that you do because we need to do, and it can be a little bit narrow, whereas movement can be a lot of other things that someone may or may not call exercise, but that is also beneficial for their bodies. Any relevant work or hobbies, and any drugs or alcohol used.
One thing that I like to include in the lifestyle history, if they mention it, is any motivational or emotional aspects. So like you can just write down, poor sleep 6 hours a night, and that counts for note taking. But writing down poor sleep only 6 hours a night because of caretaking sick husband offers a lot more context for that particular piece of lifestyle history. Same thing with motivations behind alcohol use or recreational drug use or dietary choices. Noting those in the subjective section can help to guide both assessment and plans down the note.
So here's an example of some of that information. And we can kind of see where we're using some of these techniques that Thomas has been talking about. So we're looking at, so diet, we are looking at a concise summary of what they're putting into their body. The quotes, not enough leafy greens. So that's something that the client is saying. So if they're assessing themselves and they tell you, I'm not getting enough leafy greens, then that's something that we would put into quotes, because it's not us that's assessing that, it's them. So diet can be a little bit more straightforward, although, like Thomas mentioned, in terms of like somatic or emotional, psychological symptoms, we do want to add that in if someone has issues surrounding their diet. This person didn't, and so we don't have it. Sleep, we like to differentiate between bed rest and hours of actual sleep. So you'll see here that we're saying, 9 hours of bed rest, but actually 5 to 7 hours of sleep per night. And it says here, just like Thomas was talking about, this person felt like the sleep issues and sleep procrastination was related to hip tightness, even when he isn't in pain.
And so that's not the type of thing that you would put down under objective. That's a very subjective interpretation of the etiology of his insomnia. But it's also important to understand the meaning that people have ascribed to things so that if that meaning might not align with everything else, you'll know where to start the conversation. And sometimes it perfectly aligns and sometimes it doesn't. But if we don't have a note of that, we won't be able to have effective communication in the future.
Absolutely. Yeah, and it can help us tie back, like as you're saying, to communication. Those things, even if we decide that they aren't related to that, we can still remind them and kind of tease those things apart, right? So if we decide this person's sleep issues probably aren't related to their hip tightness, we can tease that apart and show those root causes as we work with our clients and kind of gently change the narrative without having to say like, oh, you're just wrong about it.
That's good. That's good.
So movement, this person was walking every day and they did Qigong twice a week. Other things that would fit into here, of course, more traditional forms of exercise, yoga, weight training, running, cycling. But maybe this person walks dogs and they don't necessarily think of it as exercise, but they're actually getting 10,000 steps a day, walking dogs. So that would belong in movement. Someone that's an avid gardener, especially in the spring and fall, when you're waking up your garden and putting your garden to bed, that's actually pretty hard work if you're shoveling and digging and turning earth. So being a little more liberal with the use of the word movement and understanding not only what people are doing, but kind of what they enjoy doing and what they're kind of inspired to do. Relevant work and hobbies, kind of what we mean by this is things that would affect their health, either, positively or negatively. So this person did oil painting once a week. Oil paints are a little bit toxic. That is causing any of the person's health issues, but it's something that really could affect their health. Oh, we can't see this down here. And noting down at the bottom, the alcohol and recreational drug usage. So this person is having a couple of mixed drinks a day. Put it back down here. The movable PowerPoint here. We also have a current medications and supplements or an herbs section. So all three of those things. This is pretty straightforward, but also very important. It's incredibly important to know what things people are putting into their bodies before we give them additional things to put into their bodies. So as a rule, we kind of say if for any medications, whether they're over the counter or prescription, we choose to use the drug name, not the brand for medications. It's just a preference. And we want to include brands for supplements, not necessarily, we don't need those for medications, but that's kind of important. Brands can speak to quality. They can speak to, if someone is just taking magnesium glycinate, but maybe it's actually in a sort of complex and also has B6 and something else in it. And if they don't give us the name of the supplement and the brand, that we won't be able to look that up and figure out exactly what they're taking. Or maybe they say 2 capsules of magnesium glycinate. If we don't have the brand, then we have no clue how much they're actually getting into their bodies. We want the dosages, the forms they're taking. So maybe they're doing tinctures instead of teas. Maybe they're taking in a lot of capsules, but they're not doing any tinctures. For folks that aren't using herbs at all, are they taking capsules, caplets? And then knowing the frequency of use. So, 3, maybe I'm taking, maybe someone's taking ibuprofen 3 times a day. Maybe they're just taking it as they need it. And then making sure to know when they say only when needed, when is it needed, right? And so it's not just occasionally, we want to get really specific about how often they're putting those things into their body, how often they feel like they're needing them.
So this is a section that I've gotten a couple of compliments from physicians on having such level of detail. Oftentimes, if you get notes from someone's physician, if it includes anything about herbs or supplements, it will just say, calcium supplement, ashwagandha, B6. It's important to know the difference between P5P and pyridoxine hydrochloride, the different forms of B6. There's a big difference between 250 milligrams of ashwagandha and 10,000 milligrams of ashwagandha. And so when I've sent soap notes to practitioners, I've gotten a couple of compliments on how helpful the detailed information on the herbs and supplements that their patient was taking is. And also, I think that as herbalists, people tend to disclose more of what they're actually taking to us than they do to mainstream practitioners. And so that added level of detail can come in handy in a lot of instances.
Notice that too. Absolutely. That people will tell us a lot more on the intake forms than they tell their doctors. I think especially with herbs and supplements, because they're afraid that their doctors are going to tell them to not take them.
Yeah, absolutely. And I think that as herbalists, we should be conscientious that so in that case, the client is worried that because of their doctor's bias and disapproval, because of that, they aren't going to list everything. Sometimes as herbalist clients come to us with the perception that we're going to be anti-pharmaceutical, and they might not initially disclose all medications for the same kind of fears, but in reversed roles.
Oh, absolutely. That's a great point. So like I said, pretty straightforward. Here's an example for you guys of what a very simplified this medication, supplements, and herbs section would look like. But you can see we're using the drug, not we're using acetaminophen, not Tylenol. We're giving the brands for these supplements, and then they're not on herbs, so we didn't put any. We like to get a past medical history. This helps identify any medical conditions that are pre-existing, so things that folks have had in the past. and things that may or may not be contributing to the current health issue, or influence our decisions, for support and, herbal, nutritional, supplemental interventions. So this ensures kind of a continuity of care across different healthcare providers. This is something that we see a lot in the clinic. I see it a lot in my private practice. Folks will be seeing 5 or 6 different doctors getting different medications, some of which have, negative interactions, but because no one is getting a complete medical history along with a detailed enough, herb supplements, medications list, the continuity of care can get broken down pretty quickly. And it can provide an overview of our client's health status, which is really can be super helpful to know, what they have gone through, whether or not those medical conditions or those diagnoses are accurate. So this person, past medical history, diagnosed with generalized anxiety disorder at 20, doesn't relate to diagnosis anymore. I like to put that, especially for maybe more of the mental, psychological, emotional type diagnoses, because sometimes folks get diagnosed with things young, or they get misdiagnosed and they don't feel good about that diagnosis. So I like to add that in. And then this person was diagnosed with hemorrhoids 1 year ago. You can write, 1 year. You can also write the exact date if folks have it. Oftentimes people don't know the exact dates. Past surgeries, pretty self-explanatory. You just want to add all past surgeries with dates included. This can speak to, maybe Thomas has more on that. I think this can speak to, structural pain and, pain in general. Incision site, has something happened with the musculature, has something happened with the nerves. And so we're paying attention to where people had surgeries. It also is going to tell us if they have or do not have certain organs or glands, right? Tonsils are common. Appendixes are common. Gallbladders are common. Folks get hysterectomies, they get their ovaries taken out. And so it's good to know, if people have all of their parts and kind of where in the body have they been opened up.
And sometimes just knowing the number of surgeries someone's had, like somebody that has had 1 or 2 surgeries over the course of their life has a completely different risk profile than someone that's had 20 or 30 surgeries over the course of their life. Every time you go under anesthesia, depending upon what they use, but often every time you go under anesthesia, there's a potential risk. We talk about the use of nitrous oxide in medicine, especially for twilight surgeries, as depleting of B12 or potentially, driving a B12 deficiency. Less common now, but in the early 2000s, I saw a number of women who had very weird symptoms starting like 5 to 10 years after breast augmentation surgery, and the silicone implants are different than the saline, and there's like all these things that later down the road it turns out might be in play with their current health concerns. And so just getting a thorough history of that becomes really helpful.
Thanks. Yes. All right. We also get family medical history. We include on the SOAP notes, the things that are relevant to the client's chief complaints or things that their health issues. Something that I have been recently doing, you can do, like, we like to know the difference between the maternal and the paternal line. I have also started saying assigned female at birth parent, assigned male at birth parent, as folks to make some folks more comfortable that don't feel like they kind of fit in with that traditional gender role. And yep, so you can do that. That can be really helpful. And it identifies potential risk factors for, you know, health issues. So we have maternal high blood pressure, maternal and paternal osteoarthritis. And like I said, also, it's completely fine to use AFAB or AMAB parent to use more inclusive language. We want to know about allergies. So drugs, food, seasonal and general allergies, sensitivities, and intolerances. And we always want to make sure and differentiate between allergies that are diagnosed and allergies that are assumed. And even within the diagnosed allergies, who has done the diagnosing and what testing have they got to in order to come to the conclusion of what they're allergic to. This is important for a lot of reasons. One of which, because not all testing that folks use for allergies, especially when it comes to foods, is accurate. And we've seen a lot of folks avoiding many foods that they, think that they're allergic to, that it turns out that they're not allergic to. So that's a really good example in terms of diet.
And there's,
oh, go ahead.
I was just going to say, the understanding where the diagnosis came from in general is helpful, but especially in alternative medicine, there are so many bogus allergy tests out there. And people come in with an IgG food panel of 108 foods, and they can't eat 60 of them, and they've just tied themselves in knots over the complexity of trying to, stick to this unreasonable elimination diet. And it turns out that the test was complete crap to begin with and should have never been done. And once you explain that to people, it's oftentimes really helpful at reducing their stress and, improving caloric intake. And understanding diagnoses in general and where they arise from is very helpful, but especially if it comes from a naturopath, a functional medicine doctor, anybody involved in alternative medicine. We really want to know exactly which test by which lab, and then we can have a conversation about the validity of that test and what it actually means.
Absolutely. Yeah, and as practitioners, know if you don't understand the type of testing that they've gotten, make sure, we just like to do our research. Come across tests that I haven't worked with before, and I'm not going to assume that they're crap or assume that they're accurate until I kind of understand and do the research.
And differentiating between a diagnosed allergy and something more can also be important to the plan part of your process. I remember working this community clinic, and someone said that they had bad allergies. Can we help with bad allergies? The practitioner made them up an allergy formula that is completely reasonable for someone with seasonal allergies. But then I started asking more questions, and they had been hospitalized for anaphylaxis a dozen times in the last year. That's a much different type of situation than plain Jane allergies, and requires a much different type of program. So not assuming that what they report as an allergy is actually an allergy when it might be MCAS or something else is helpful here.
Absolutely. And also in terms of assumed allergy for foods, like if someone puts that they're allergic to gluten or dairy or something, and you just assume that that's accurate without digging into it further, those people might never eat foods again that they're sensitive to, maybe because they have a gut issue that needs to be healed, and then they'd be able to eat those foods again. And so in terms of food allergies specifically, really being clear on why they're calling it an allergy. And this is more common in folks that are just assuming that they have an allergy because they have a negative reaction to something they're putting in their bodies. So here's an kind of example. We have a bunch of different things. So we have stone fruits cause terrible canker sores. An allergy? I don't know, maybe something else. But they feel like it's an allergy, so we're putting it here. Diagnosed seasonal allergies. I would have liked to maybe see in this one, doctor diagnosed, naturopathic diagnosed, like Thomas was talking about. Tree pollen's ragweed, sensitive to dairy. Pineapple makes throat itch. The next part of the subjective heading is a review of symptoms. And this is a structured way to gather information about kind of an overall health status. It's organized by body system. You don't have to use every system. So you don't have to, if a client doesn't report anything, or if in your findings throughout the intake, you're not finding any issues within a body system that are related to their health concerns or that you think are relevant to their health, you can completely skip that body system. And this is to identify signs or symptoms that may be relevant. Things that maybe you don't know that are relevant until you're looking at them at the end. So here is a bunch of topics. We're going to go through and look at each one of these. And so I won't read them all out. So here's an example of kind of neuropsychological. And here we say neuropsychological, emotional, mental state, and kind of nervous system info if they have any, physical nervous system issue. Like, maybe they're having tingling or, sharp shooting pain that's potentially a nerve issue. So it's like, or like shingles, there can be nerve pain and it's affecting nerves in that way. So this is a good example of a kind of a bunch of different things. It is a little more narrative, and often the neuropsychological section and the kind of talking about emotional and mental health is going to be a little more narrative than other body systems because of the nature and the expression, like Thomas was talking about in general. It's more important to know how things are feeling in their body, and this can help with herb choice and just kind of help us to understand what's going on. This person in particular was dealing with a lot of anxiety, difficulty making decisions, patterns of anxiety and depression, peaks like a wave and then gets depressed. Thinks anxiety about life tasks correlate to held tension in the body and hip. When depressed, it seems doesn't like to get out of bed, feelings of apathy, no desire to connect socially. I'm going to skip some. I really like feels like a husk. Not like that they were feeling that, but I think that was a really key thing to choose to put into it. Talking about their anxiety and depression, this feeling of hollowness, that can give us a lot of information. It really gives me a visceral feeling, even reading that. Low level anxiety all the time. We have some things that make it worse. Protein intake goes down and depression gets worse. It's worse when it's dark from the winter or from rain. And then it's saying, protein, vitamin D, laying any under bright lights can make it better. That's really helpful information to do kind of just in general as herbalists, is to get that info from our clients. But it's really helpful to put it on soap notes so that when we're creating interventions during our plan section, we can look back to those things and know what's already helping. Microdosing helps. Psilocybin helps both anxiety and depression. Head, ears, eyes, nose, and throat. This is just symptoms that are going on. So in these body parts, this person had a lot of earwax buildup. cardiovascular. So we're seeing this is, it can be peripheral or central sort of cardiovascular issues. So this is where we're putting blood pressure. This is where we're putting heart palpitations, arrhythmias, heart murmurs. You can see here this person has hemorrhoids with spotty bleeding and rectal prolapse. And varicose veins. So we're seeing here this kind of pattern of maybe laxity in the cardiovascular system, right? So we're seeing hemorrhoids, we're seeing varicose veins. And so making sure we get everything down, we'll be able to start to kind of see patterns forming. Low to low normal blood pressure. We put everything together. So we put reproductive or generative health and urinary tract health kind of together as a genitourinary tract. And we don't differentiate like gender to gender. So we put everything under one heading. And so we can see this person has a mixture of some urinary symptoms as well as low libido. Oh, we've got 2 genitourinary tracts. Gastrointestinal, this is a pretty short gastrointestinal compared to most of our normals, but we like to know how often they're going to the bathroom, what is the consistency of their bowel movements, what is the color, and things that can trigger whatever digestive symptoms that they're having. Musculoskeletal system, this person particularly had hip pain and tightness. We want to make sure we're talking about where it hurts in the body. Is it deep? Is it close to the surface? Is it on the left side, the right side, lower abdomen, upper abdomen? We're looking at, this person was a body worker, so had a little bit more, was able to speak a little bit more to what was going on in their bodies. Person thinks that this tightness on the left side has to do with the callus on their left foot. So there again, we're not only putting information we're getting from the intake forms and from asking questions, but we're putting another little insight from the client on what they think is going on. And then we have our skin section. So we can put things about acne, oiliness, dryness. Chapped lips is a pretty classic sign of dryness, especially from not getting enough liquid in. That's important to know. Dandruff, yeah, how dry is skin? Where is the skin dry? Is it only dry on your arms? Is it dry everywhere? Are you just dry on your face? Oftentimes we'll do hair and nails as well as extensions of skin, even though they're not actual like skin tissue. All right, jumping to the objective section, we are definitely going to go over for folks that do not want to stay past the hour. It's being recorded like we mentioned in the beginning. So the objective section is where we put measurable data, and this data is obtained, through observation, through examination, and diagnostic tests if they come to you with diagnostic testing. We include things like tissue state, energetics, visible signs that we're seeing, right? Like if someone, often folks in hypothyroidism are missing the outer third of their eyebrows. So we're looking at people and those sorts of things that we're seeing, we're putting those down into the objective section.
Basically, anything that anybody else can reasonably observe or that is reasonably quantifiable goes here.
Absolutely. In this section, we want to avoid assessment. And these are the things that we can list, right? These are the things we don't need to write full sentences and make it kind of a long thing. So here's an easy example. We have people's height and weight. We're seeing dry skin, peeling lips, nails. We're talking a little bit about their tongue, where this tongue is pale and scalloped. A little bit of energetics here, so some musculoskeletal tension, blood pressure, vitamin D levels, noting that there's no other blood work available. Okay, where's this? Oh, I see. So this is an example of this is an example of what not to do in the objective section. So this has a lot of big formal sentences. We're seeing here, this person says that the skin on her legs is bumpy and also dry. We're not visualizing that. So I personally wouldn't put that on if I hadn't visualized it or seen a picture of it. Lips are chewing or peeling, and then we have an assessment here. So we want to avoid things like, so lips are peeling, that belongs in the objective. It seems like she picks or chews them. So wanting to avoid kind of language like that. So the assessment section is kind of the most challenging part of doing a SOAP note. It's because where we're putting all that information together. So we're analyzing all of that subjective and objective information to evaluate our clients' kind of health concerns. We're doing a differential assessment, which includes all the potential root causes of the client's primary health concerns. We 100% as herbalists are trying to avoid suggesting diagnoses or diagnosing, and instead talking about what I like to use is symptoms suggestive of. What do you say, Thomas, in yours?
Yeah, symptoms suggestive of or objective data and symptom pattern might indicate blah de blah, refer to so and so. I think this part for herbalist is maybe more difficult than some other healthcare professionals that use SOAP notes. Many times in other practitioners will use SOAP notes in a very limited way to focus in on one or two symptoms. But we're trying to look at everything, right? We're assessing not just the potential for disease. We're and we aren't diagnosing, but we're assessing for function, and therefore the potential for disease. But we're also assessing health, which is a different thing than disease, and we're assessing, adaptations that have occurred, and we're trying to assess multiple issues at once. And so this can be a difficult place to be concise, which is what traditional SOAP notes are designed for. I would say in the assessment, this is the one area that I don't shoot for brevity. I like to, include as comprehensive of an assessment as possible of kind of everything that the person is going through, not just one very narrow thing.
Yeah, I agree. So we're going to look at a couple of assessments here and just quickly run through what is being done right and kind of what doesn't look so good here. So something we really want to avoid while we're assessing is using diagnostic language, which is why we use things like symptoms suggestive of. So saying something like client's vegetarian diet and low caloric intake is causing a B12 and an iron deficiency is not something that we want to say. We would like to say something like symptoms suggestive of B12 and potential iron deficiency. Let's see, what else do we have here? Directly saying person has a vitamin D deficiency is without acknowledging that potentially who made that diagnosis. So if someone got blood work from their doctor and their doctor said, you are anemic, you have iron deficiency, your vitamin D levels are low, then I put Dr. DX on mine. And that's kind of what we're going back to that idea of liability. Not necessary. I do it anyway. I think that it is really helpful and it's a short thing to do. We also don't want to start making suggestions here, right? So they really need to start eating meat again, especially because they are breastfeeding. This is not only, not super accurate necessarily, but it doesn't really belong in the assessments. There again, clear markers of hypothyroidism, avoiding things like that, symptoms suggestive of hypothyroidism. Causing generalized anxiety disorder. Yeah. And so we're looking at something that's written just a little bit, a little bit better. Client's vegetarian diet and low caloric intake may be insufficient in providing essential nutrients like B12 and iron, contributing to dry skin, cold extremities, breathlessness, neuropathy. Doctor diagnosed low vitamin D. We have info of their tongue. Pale tongue could also potentially point to anemia. And so we're going through this whole thing and making sure, here's the word suggestive again here next to hypothyroidism. Lack of sleep and stressful nature of early parenthood make anxiety likely. Refer to PCP for blood testing. And that's especially if you don't order, if you don't order blood tests yourself in your own practice. Yeah, and we talked a little bit about, we just talked a little bit about this. I feel like it deserves just a little bit more. Because I've seen in myself, when I started learning to write SOAP notes, the assessments are challenging because of everything that Thomas said. I think it's also because if you're so let's say that I am a Western herbalist, I use the 6 tissue state model. I also do some functional, like functional herbalism type stuff. And so we're using nutrition and we're using, sometimes we're using blood work. We need to be skilled enough in whatever assessment model we're using to come to conclusions about what's going on with our client's health. We need to be able to, in general, understand the signs and symptoms of various health concerns. You're going to miss that someone has hypothyroidism if you don't know the signs and symptoms of hypothyroidism. It's a good example. You also need to know how and where to research when you don't know the answer. So that can be reaching out to a colleague or a teacher or a mentor for help, or reading something like we like UpToDate, which is if you type in like hypothyroidism UpToDate, it's a website that is like a comprehensive write-up on a health condition. So they'll talk about etiology and contributing factors, signs and symptoms. But that's really, and then you also need to know when to refer out. So assessments can be a bit of a puzzle because of all of those things.
I like to think of assessments as your hypothesis and your plan as the test of your hypothesis. So this is where you're trying to reason out and explain your reasoning behind what might be going on. And then in your plan, that's where you describe the way that you're going to test that hypothesis, the way that you're going to try to figure out if your understanding of what was going on is correct or not.
I love that. And to plan. So the plan is where we organize all of our client health recommendations. This is going to look really different depending on how you practice. But in general, we want to always include dosages and basic instructions for use. And in general, we want to make sure that our health plan suggestions match our assessments. So if we're suggesting bitters to someone, we want to be suggesting that because of a symptom that's being presented to them.
And I can't emphasize the importance of this enough. If in your assessment you includes that the client has diagnosed diabetes. And that was also one of their, chief complaints, their primary health concerns that they brought to you. But then in your plan, you don't have anything to help their blood sugar. You've not logically linked what they came to you for and what their assessment is with the intervention that you're recommending. This is something that I see a lot, especially in new herbalists who are really like herb enthusiasts, and I guess we're all herb enthusiasts. There's probably a better way to say that, but like new herbalists are very likely to recommend a lot of herbs to people. They're doing the appointment and they've got their notebook, and anything that pops into their mind, they write down. And a lot of times they put that on their plan before filling out the SOAs, and then it just doesn't align. It doesn't match. This is where you're testing your hypothesis, and if you aren't testing your hypothesis, if the plan doesn't have a way to address what was put in the assessment, then you're not really doing good science, right? You've got to have both things working hand in hand.
And another reason that it's important for our health plan or our health plans to match our assessments is because if your client is coming to you, like Thomas said, because of their blood sugar, and you're not doing anything to support them with their blood sugar, it's going to be difficult to build rapport, and it's going to be difficult for our clients to connect with us and to trust that we feel, like that we've heard them and that we're addressing their complaints when we're not actually addressing their health issues.
And there are absolutely some health issues that are unaddressable, but you should include in your plan that you're going to talk with your client about that, right? So like, fictional example, somebody comes to you and their primary complaint is stage 3 pancreatic cancer. Nothing in your plan is going to directly address that. But if that was their expectation upon coming, then your plan needs to include, education about current diagnosis and limitations of alternative medicine or herbal medicine or mainstream medicine, whatever it may be.
Absolutely. And in that way, we can help our clients to redefine their health goals. Right? If a client's coming to you expecting you to do something that you can't do, with that education, we can use that to say, let's look at some more realistic goals. Absolutely.
Yeah, I often have to talk with my clients about like, despite your diagnosis and prognosis, we can focus on building health within your illness. We might not can do anything directly about that illness, but we can always build health. We can always improve vitality, almost always improve vitality. And so that needs to be articulated both in your plan and to your client.
Absolutely. So here is an example of a health plan, how we kind of break things up. So we put some herbs at the top. We'll see here that we have the form. So here we're wanting someone to use ashwagandha capsules. And we have the dosage. We have the amount of times per day that it's being asked to be taken, and any specific dosing instructions. In this case with ashwagandha, it can be helpful for sleep as well in some cases. So we like to give the last dose before bed. Here we have some bitters. Probably I would have liked to see this say, tincture or glycerite. it's still the bitters. We put the herbs that are in it and the dosage. So this one is 2 meals 3 times a day. We take 5 to 10 minutes before meals to stimulate digestion. We do the same thing with our supplements here. So we're giving exact dosages. For instance, here I would like to see the type of D, so D3. In this case of the vegetarian, we're doing algae omega. And we have the dosage here. We have when to take it for maximum absorption. So with fattiest meal, that's important information for our clients to have. And this is for us, right? And health plans for your clients can be copied from here, and you can add any additional information that you need. Under lifestyle here, there can be a bunch of different things depending on what lifestyle suggestions you're giving. We're always going to address diet, and often we'll address some movement, not always, especially not in the beginning. But you're seeing we're giving specific dietary suggestions, types of oils to cook with, an amount of food. We want someone to eat half an avocado a day, a couple of Brazil nuts a day, using rosemary to spice foods, giving some really specific protein goals and the times of day to get them. And when we do suggest movement or something, movement, maybe there'll be relaxation techniques, breathing, and depending on on how you practice, we'll see we have weight training sessions here and suggestions to stretch with this person's baby in the morning. And then we come down here to the very bottom, you can barely see it, resources. You can link your resources back to the things that you want your client to do. So if someone that has no clue you just picture yourself in your client's shoes here. And maybe for not everyone, you can suggest just weight training and they're going to know. Maybe not everyone is going to feel comfortable just starting to stretch without some resources. So we see here, we have some mama baby stretching and some easy beginner strength routines.
And I would also say that we emphasize in our program that lifestyle interventions, including diet and movement, should really be co-created with the client. So in this section, we're not putting down stuff that the client has never heard before, that we haven't talked about. This is where we're creating a synopsis of what we've already talked about. So we've already, done the motivation and education piece. So we've already assessed how willing they are to make change or their capacity for changes. That's all done in the consult. This is the synopsis of the result of those conversations. This is not like a dictation of you've got to, do this exact thing.
Absolutely. That's a great point. We also have a section for referrals and any particular blood work. We use some basic blood work to help us gain information about our clients. And in this case, CBC, CMP, which are kind of basic, just kind of the very basic baseline blood work. We're doing some testing for the thyroid and for ferritin, because ferritin is our preferred test for iron deficiency. If we think back to the assessment, these things are going to directly speak to symptoms that the client is having. So we're not going to get a bunch of blood work because it's fun. We're not going to get a bunch of blood work because it's interesting. We're going to request blood work acknowledging that our clients are going to have to get stuck by a needle. Most likely, unless they have really good health insurance, they're going to have to pay a decent amount of money for this. So we're wanting to do it as little as possible and only the tests that we need.
And, if you cannot logically argue for an assessment, you probably don't need a test. By that, I mean, if you test for everything, you will find something wrong because of the nature of testing, right? Like all medical testing includes some level of false positives. If you test people for things that their symptoms and signs don't suggest, you're very likely going to, at some point, get an incorrect assessment and an over-treatment because of that incorrect assessment. So we don't recommend people go in for full body scans and PET scans and, $5,000 blood work packages for organic acids. And no, we focus on the things that are likely to show results based on the subjective and objective information and the assessment that we've crafted from that.
Absolutely. Well, I wanted to kind of stop paying attention to time and to peek into the chat and see if we want to give folks some time to ask any questions before we head out for the evening. Let's see, do we?
So Susan says that when you say that the plan is what has already been talked about in consult, was that in the initial consult, the second consult? I still find it difficult to make recommendations on the fly in the first consultation. So that's a good question. And let me clarify, Susan. The lifestyle suggestions in the plan are always talked about before the recommendations are made. I will often say, I'm not sure exactly what type of herbal formula we're going to do yet. It probably will have milky oats and saffron in it. I will say, I'm not sure, the exact blood test that we will need until I get a chance to review your past test and current, diagnoses. That's okay. That part of the plan you don't have to give during the initial intake. But before you write down exercise for 30 minutes, 5 times a week, or do high intensity interval training 3 times a week, before you put that on your plan, you have to have a conversation with the person about their capacity for that, their willingness to do it, their motivation to do it, because one of the most demotivating factors or things that you can do as a clinician is put together a plan that cannot be stuck to.
It's so discouraging for clients.
It's
it often makes them ghost, right? And that's a whole other conversation. But if we overwhelm and disempower our clients, they're probably not going to come back. And it probably was your fault. Not always. Clients ghost for a lot of reasons. A lot of the reasons are from practitioners. And we kind of teach our students, I always call it, I don't know what Thomas calls it when he talks about it. I like to call it a resource audit. But what it is, it's exactly what Thomas is talking about. What is their capacity for change? What are their energy levels? And we kind of do that a little bit throughout the consult. And then I check in at the end and say, okay, how willing are you? How much time and space do you have for movement? How much time and space do you have for this or that? If I gave you a plan that included a tea and a tincture, would that feel too overwhelming? And so we're checking in kind of about those implementation and the space that people have in their lives to make changes.
Lou asks, as an herbalist, are we legally allowed to ask for blood work, or should we be referring them to the physician's suggestions for the blood work? So in the United States, with just a few exceptions like New York State and maybe 1 or 2 more, people can order their own blood work at any number of walk-in labs. Many of these labs will allow unlicensed practitioners to also place blood work orders on behalf of their clients. Ordering blood work is not inherently diagnostic and is not inherently against any U.S. law or regulation or practice of medicine acts for any state that I know of. Blood work provides objective information about people, just like a blood pressure monitor does or a thermometer does. And if you can use a blood pressure monitor and thermometer as an unlicensed practitioner, you can also use blood work. I use walk-in labs. I've used direct labs. I've had accounts with Quest. All of them offer some small price break to practitioners. like walk-in labs, I get a 10% price break on their advertised prices. I pass that along to my clients. So by signing up as a practitioner, you can not only order blood work, but you can save your clients that don't have insurance a little bit of money in addition.
Mhm.
How do you deal with clients who want to use their homemade medicine? If you don't know the percentage alcohol ratio, where the herb was gathered, if the herb was actually that herb. I mean, I think that you can have a conversation with someone about their wildcrafting and medicine making practices and get a general idea of the quality of medicine being made. I will absolutely have people use their own medicines if they're hard to mess up, if they're not a special preparation. Like I use a lot of fluid extracts. So home medicine makers typically don't use fluid extracts. So in that case, my fluid extract of astragalus is 5 to 10 times stronger than your folk method astragalus. You could use your own, but you would have to take tablespoonfuls versus milliliters of mine. If you're okay with that level of alcohol intake, then we can work on that. But many times, if you explain to people the potential differences in quality, they'll want to use your tinctures instead.
Or they'll be excited and they'll want to make tinctures the dosage that you're suggesting. I have clients that do that. People that are already kind of into making medicine. If you can kind of give them those skills, then
Yeah.
if they really want to make it themselves, they can still do it. Going through more here.
So in the plan section, I would include things like continue your Tai Chi practice 2 times a week or continue walking 5 days a week. Yeah, if I think something that they're already doing is important to their ongoing health, it absolutely gets listed here and maybe even gets a smiley emoji next to it.
Mhm. I do that too.
How do you go about validating the allergy test you mentioned? So luckily we have specialists for all different aspects of medicine, and the people that specialize in allergies have their own associations and groups and guidelines, and they publish which testing methodologies are supported and why. And so I use primarily mainstream validated blood test. I think that most tests that are rejected by mainstream medicine are rejected for good reason. And so I tend to stick to what the people that devote their entire lives to understanding allergies say instead of what somebody trying to sell a blood test says. Yeah, in your plan, you do include referrals to physicians, so that might not be in the immediate plan if they don't have insurance and they want to get blood work out of pocket. But if the results come back supportive of the possible diagnoses, then plan 2 includes a referral to their primary care. Sometimes plan 1 does, depending upon what test it is, their insurance status, their relationship with their primary care if they have one. There's a lot of considerations here, but if you put suggestive of hypothyroidism in your assessment, your plan should include either a referral to a primary care or a referral for blood work one or the other.
Right.
Oh, Gabriel, of course. Yeah, you're a Sagittarian. I didn't know.
Mhm. And having a good
Protocol
conversation.
versus plan verbiage. Yeah, I don't. Yeah, I'm fine with that. I think that's the questions.
Yeah, I just doubled through too. Does anyone have any additional questions? Well,
Oh yeah,
oh, go ahead.
I was just gonna say, Gabriel mentioned the ham A for anxiety. There's also a ham D for depression. You don't have to stick to a scale of 1 to 10 for a chief complaint if that chief complaint has a validated assessment tool like the ham A, ham D. We use a mood check. I like the SES-D for depression. There's a lot of validated tools out there, and you can absolutely, um, you can say chief complaint to depression onset 2018, SES-D 28 instead of on a scale of 1 to 10. You can put those scales in the objective info.
Absolutely. Well, everyone, thank you so much for coming. We have a couple of offerings that might be useful. We have something called the Clinical Calyx, and this is a monthly subscription service that includes a bunch of different sorts of classes and research. We call it the research roundup. So it's Thomas's chance to geek out on something interesting, very interesting and clinically relevant. And we also often do clinical skills classes. We have a forum that is super fun where we talk about cases and classes and information. It includes access to the bots. Thomas, is that
It
correct?
includes access to the bots, and it includes the live streamed once a month consult.
Oh, we have a ball during, we call it Chia. It's our live stream clinical herbalism in action. It's super fun. Tiffany or myself or whoever isn't doing the consult will be doing the chat as well. And note that one of our bots can help you write soap notes. So if you put, it's good to practice and it makes you a better herbalist to write assessments and to organize this information. Sometimes we don't have time. If you're seeing 20 clients a week, maybe you can't have time. You don't have time. And what is the name of the bot that can help write soap notes, Thomas?
Scribebot. I call it
Scribebot.
soap, but Scribebot is its preferred name, and you can take your intake forms, blood work, medication list, any information you have, you can copy and paste it in and hit the button, and it will generate a soap note with all of that information organized like it's supposed to be. There's also some added bonuses to Scribebot in that any medication that's mentioned, it includes the class or mechanism of action. It also spots red flags and, helps to identify urgent referral issues. So yes, lots of things for.
And if you're interested in you know, if you're interested in our clinical program, you can go ahead and email me. It's mel@eclecticschoolofherbalmedicine.com, and I am happy to answer any questions that you have. We teach soap notes in our program, and we teach a bunch more of these clinical skills. We have 8 to 12 weeks just dedicated to learning clinical skills in relational health, not to mention all of our exciting and fun classes.
And
right.
and then the case reviews afterwards build on all of that. So we get to guide you through the whole process of developing as a practitioner. It's a lot of fun.
Mm-hmm. Oh, we have live Q&As for our program, all of our program students once a month that are also really fun. You basically put any question you want to ask related to, you know, practice of clinical herbalism into a document, and we just talk about them. Sometimes it's an hour, sometimes it's an hour and a half, but it's also really fun. Thanks, everyone.
Thank you, Mel. Thanks, everyone.
Thanks, Thomas.
Have a good night.